Okay, class, I'm going to teach you how to set up the MyoTrack biofeedback machine. This can be used two ways, to facilitate or inhibit. And now there is no electric current that comes out of this. This is just going to give you a visual feedback if there's any muscle activity here. So let's look at some of the knobs right here. This is the volume here. This is the off switch, continuous, and then threshold. This one here is 1x, 10x, and 100x. This is known as the gain, and then here's also the threshold. It goes from 0.5 all the way to 10. So let me give you an example of how to calculate the threshold. If this is 10x and this is at 0.5, 0.5 of 10 is 5, so the threshold would be 5. If I put this knob to 1, 10 times 1 is 10, so the threshold is 10. If I put this on 10, then 10 times 10, the threshold is 100. If it's at 100, then you might want to just switch it to 100 here. But let me show you what that means here. And again, when you put the electrodes on, and you can look at some of your handouts of where to put this, you want to put the triode electrode parallel to the muscle fibers. So if you were to put it on the quads, the VMO, you want to put it parallel to the muscle fibers here. Now, let's turn this on so you get an idea of what's going on here. So right now, the green means that there's no muscle activity, okay? At 1x, that's highly sensitive, and it's able to pick up very, very small amounts of activity. At 10x, it's moderately sensitive. It's a good place to start for the average patient and the student. And at 100x, it has very, very low sensitivity. That means it has to pick up high amounts of activity. That's really good for if you have overactive muscles and you're trying to inhibit them and say, hey, let's use it to calm the upper trap down. So you can kind of play around with that. Now let's look at this. Let's start at 10x, which is the gain, and then 0.5. If I ask the patient to contract their quads, look at this. I'm contracting and it's going way past the edge and just off the charts. So that tells us that the threshold is too low. I can increase the threshold. Let's increase the threshold to 1. So 10 times 1 is 10. And now, still way off the charts. So the quads are doing really good. Well, our goal is to get it right where the green and the yellow kind of what starts to change here. So where the green light changes to the yellow light. So right around there. Okay, so that's too much. Let's change the threshold to about 3. So 10 times 3 is 30. And let's see. Still off the charts. That means their VMO is pretty strong, or their quad. Now remember, you can't really isolate the VMO versus the quad. So really you're just measuring the quad activity. Okay, now here's the 5. That seems to be pretty good right there. Perfect. So our threshold is about 50. So once you've established the threshold, then you can ask the patient to do the exercises. So I can ask them to do a straight leg raise. I can ask them to do a quad set. Right now, I'm just asking them to do a quad set in the background here. And I'm thinking, okay, try to get it in the yellow, try to get in the yellow. 1, 2, 3, 4, 5. And hold it, and then relax. I can hold it, and then relax. Okay? And we can do 10 repetitions of that. So that's facilitatory, right? We're trying to get that quad to recruit, and we want to measure the electrical activity in the muscle.